How many of you are excited? It's 3 o'clock in the afternoon. Yay! How many of you, if you weren't here, would be taking a nap right now? Yeah, me too. This is my nap time. So we have to really be excited right now because we have a great presentation, and I'm really glad you're here. I'm Sandy Spivey, and I'm from Southern California. I'm a Match Helpline volunteer for After Breast Cancer Diagnosis and Living Beyond Breast Cancer, where I speak to others who have metastatic breast cancer. And I get lots of questions, and I hear a lot of information. You can see I'm wearing 3 beads, all right? My initial diagnosis was triple negative. When I got it in my bones, it was ER positive. And when I had a second primary, it was HER2 positive. So I'm wearing 3 beads. It's changed every single time. And I've been living with metastatic breast cancer in my bones since 1998. I've seen my kids graduate from college. I've seen my daughter, Fo, graduate from college. We found out later she didn't have enough credits. We found out I saw my son graduate from college, high school, and get his law degree. I saw my daughter finally get her college degree. And I saw my son get married once, and then again. But welcome to this breakout on integrative medicine and metastatic breast cancer. As a reminder, we'll have questions for the end, so please use your cards. If you've run out of cards, just use paper, do the best you can. And we'll have, who's gonna help pick up cards? Anybody want to, oh, you're going to help pick up cards? Okay, thank you. And we'll bring them up here so that we can get the questions answered. And we might do a walk around out here if you want to do that. We'll figure this out as we go through, okay, how it works. So now I'd like to introduce Dr. Gary Asher. As Director of Integrative Medicine Services, Dr. Asher oversees the delivery of complementary and alternative therapies at the NC Cancer Hospital in Chapel Hill and its Outpatient Survivorship Center. He provides integrative medicine consultations for patients. Dr. Asher's research focuses on the cancer chemopreventive and chemotherapeutic potential of curcumin. How many of you heard of curcumin before? Oh, good. In colorectal cancer. Currently, Dr. Asher is conducting early phase clinical trials to test the comparative bioavailability and tissue deposition of different formulations of curcumin to identify biomarkers of effect for curcumin in humans. And at this point, I'd like to introduce Dr. Gary Asher.
Is this on? Can you hear me? Yeah. Terrific. So I have a house full of young children. It is nap time for them too. I would be napping with them if I was home as well, so I'm glad that you all make it. I'm glad that you're all here and awake so that I can talk with you about integrative medicine. I'm Gary Asher. Welcome. Come on back. We're going to go down the hall to room number 4 on the left. Please have a seat anywhere you like. This is the way that I start off every one of my consultations, and the patients don't typically know it yet, but I've just thrown them a curveball because there's 7 seats in my room. Everybody kind of struggles with this when they walk in the room, and this is usually the first indication that they have that the visit they're about to have with an integrative medicine provider is maybe going to be a little bit different than any of the other visits they've had with other providers previously. So after a little bit of negotiation, where should I sit? I've got comfy chairs over here. I've got a table over here with chairs. I've got another chair in the corner. Sometimes I get a whole bunch of family members, and we just spread ourselves out in the room. It's terrific. We'll talk about it a little bit. We'll settle ourselves down. And I'll say, okay, so let me just tell you a little bit about myself. I'm a family medicine physician. I've trained in practice in acupuncture, trained in practice in herbal medicine. I've trained in practice as a massage therapist. So I know a little bit about each one of these things and probably a whole bunch of other integrative therapies, and that's kind of what I know. We have about 45 minutes to talk, and we can talk about whatever you'd like. Okay? I've had a look at your record. I know that 7 years ago you were diagnosed with breast cancer and you got some chemotherapy and you had a lumpectomy and then maybe some radiation. You were on tamoxifen for a while. And about a month ago you felt another lump and you went back to have that looked at, and it turns out there was a breast cancer recurrence, and there's actually now some metastases in other places in your bone, in other places in your body. You've been talking about this with your oncologist and you're sort of thinking about, well, what should I do next? Does that sound about right to you? And this is where we start. What happens from here is kind of interesting. Let me just ask a question of you. On average, how long do you think it takes for the typical medical provider to interrupt the patient once they've started talking? Hold on a second. Somebody knows this. Terrific. Wait, well, let me tell you a joke first, okay? And for this joke, I need your help, okay? And you'll know exactly what I mean as soon as we start. Ready? Knock, knock. Interrupting chicken. Now, like I said, I have a house full of young kids, and I can't go a single day without having this joke foisted upon me by at least one of them. The 2-year-old loves it because she just likes to go "Bakak, bakak, bakak" all around the house. But this is a terrific joke in my house. When I go to see a medical provider, though, right, I'm not really interested in the interrupting chicken. So I ask you this question: how long does it take the typical provider to interrupt you? Somebody over here already yelled out the answer. 18 seconds. Actually, so it's actually gotten a little bit longer. So when I went to medical school, when I learned this a couple of decades ago, it was 17 seconds. So apparently the average has gotten a little bit longer. It's 18 seconds now. And I sit down and I say, we've got 45 minutes. What would you like to talk about? I love this. As a primary care provider, I can't do this. I've got 12 minutes. You know, your providers are compressed. Now, why is it 18 seconds? So one of the things about 18 seconds that always amazed me is there are some people that take longer than 18 seconds, which means there's some people that take less. Right? That's an average, right? That's pretty amazing. And there are a lot of reasons for this too. You know, 12-minute visit, how do you see a patient and get all of their information and talk with them and make them feel like you've actually listened and done what in 12 minutes? It's impossible. So I try and do this in 45 minutes or so. And why do I do this? Why do I think this is so important? Why am I taking so much time just to make this one point? Because when we go and we talk to patients that come see an integrative medicine provider, they all tell us pretty much the same thing, right? Up here, the health of my mind and spirit are related, and whomever takes care for my health should take that into account. I can't do that in 12 minutes. And truth be told, I can't do that in 45 minutes either, but I can begin to do that in 45 minutes. And so when I say we have 45 minutes to talk, what would you like to talk about? I mean it. I want to hear what you have to say. I want to listen to your story. And I sit there and I shut my mouth and I listen, hopefully more than 18 seconds. And that's kind of where we start. So when I think about, well, what do I have to offer patients with metastatic breast cancer? What does integrative medicine have to offer that's different? This is one of the things that stands out to me. We want to hear the stories. We want to think not just about the tumor or the symptoms that you get, which we do want to hear about, but what about the rest of you? Because when do you ever really get to talk about that? Some do, some don't. Okay. So for the rest of the talk, which is going to be brief because I really want to get to your questions, and I think your questions are going to probably ask all the things that I might talk about in a very detailed talk anyway. I want to start with a couple of definitions so that we know we're talking about the same thing. I want to tell you a little bit about the CAM therapies in general, and I expect that there will probably be lots of questions about specific ones. I will tell you a little bit about a framework that I use that you could start to think about in terms of how do we think about any kind of therapy, whether it's a integrative medicine therapy or otherwise, and just a little bit about talking with your doctors. And then we'll kind of get to your questions. Hopefully this won't take more than 10 or 15 minutes, something like that. So integrative medicine, we start here, right? The name of the talk is integrative medicine, right? This is the combination of approaches that includes hopefully best or evidence-based practices even from conventional medicine and from CAM therapy. And CAM, that stands for complementary alternative medicine. I'll get to that in just a second. And this is an incredibly important and, it attempts to address the intellectual, emotional, and spiritual aspects of illness in addition to the physical. Sound familiar? Right? That's what patients are telling us, that's why they came to us in the first place. And we've sort of made a definition that follows it because that's what we try and do to some extent. That's integrative medicine. Back up just for a second. Remember, conventional therapy, CAM therapy. So this is really what's out there. What is CAM therapy? What do I mean by this? Everybody seems to mean something different. Here's what I mean. It's pretty much anything that they didn't teach me in medical school. And actually, in the early 90s, when the term alternative medicine was coined, that was the definition. Anything that wasn't taught in conventional medical school, that's alternative medicine. It's the alternative. It turns out, when you ask people what they're doing, they tend to think more about complementary medicine, the things that they might do together with conventional medicine, as opposed to alternative medicine, which would be the stuff that they might do instead of conventional therapy. Right? So CAM therapies, really complementary and alternative, mostly complementary. And I think I had, down the bottom there, I kind of skipped over that. Most folks think using CAM plus conventional therapies is superior to either alone. That's another common sentiment. We probably 70 or 80% of folks who seek integrative medicine therapy feel this. Let's do it together, complementary, not alternative. Usually that's a point I like to make to providers because they're often afraid that when folks talk about integrative medicine, they're talking about not doing what they're talking about. They want to go do something else. And that's typically not the case. All right. So CAM therapies, what are we talking about? For me, it's to divide these up into 4 buckets, right? Mind-body therapies, and I'll give you examples for each one of these. I'm sure you all know this anyway. Mind-body therapies, the biologically based therapies, body-based practices, energy medicines. Those are kind of the big 4 buckets. And then there are these whole medical systems. The medical system from China, there's actually more than one, or Japan, or Korea, or India, which is Ayurveda. Actually, there are a few from India, or homeopathy, naturopathy. And many of these whole medical systems actually scan the gamut of the domains that I talked about. They may have some dietary recommendations, some mind-body things like meditation. They might have some herbals. And so they kind of will go and actually have therapies in each one of those domains. All right, so what are we talking about in particular? Mind-body medicine. This is not an exhaustive list. It's just an example of a number of the types of mind-body therapies we have some evidence on that we know actually can help patients with cancer. Meditation, yoga, tai chi, hypnosis. Nothing here that most folks at this point haven't at least heard about. Not everybody may have experienced it, but most folks have at least heard about it. Guided imagery, progressive relaxation, biofeedback. Again, this is all the stuff that most of us don't learn about in medical school. Meditation is now starting to make some inroads. There are folks in Georgetown University who are doing the mindfulness meditation with medical students, which is phenomenal. That's Adi Haramati for anybody that's interested. Occasionally you'll see biofeedback, but not too often. Then we have things like cognitive behavioral therapy and counseling, which actually is a complementary and alternative medicine. It's not taught in medical school, although it's starting to be. Support groups, expressive therapy, all of these things are part of that mind-body basket. And there are others as well. What else do we have? Moving on, the biologically based practices, vitamins and minerals. Okay, everybody takes those. Most people take those. Herbals. And then there's this group of, they're not vitamins and minerals, they're not herbals, probiotics, it's a bacteria. Or fish oil, the oils, CoQ10, things like chondroitin, glucosamine. These are the biologically based practices. What I don't have up there, but I expect somebody's going to ask me a question, are diets as well, and dietary interventions would go into this group as well. Body-based therapies, massage therapy, lymphedema therapy. I would add exercise into here, although nowadays, you know, that's becoming a little bit more standard to at least make an exercise recommendation, particularly in cancer and for other chronic illnesses as well. By the way, at the bottom of these slides, you'll see, you know, pain, anxiety, edema. Here's places where there's actually some reasonable evidence that one or more of these therapies may be useful for that particular problem. Finally, the energy therapies. This is really, this spans the gamut from, I think of the light touch therapies like therapeutic touch and Reiki, but this is magnets, this is colored lights, this is prayer and distant healing, and this can be really anything, it often becomes the woo-woo category. But I think there are actually some gems in here for us as well, particularly when thinking about quality of life and stress reduction. Okay, a little bit about a framework. How do I think about? So actually, this is from a talk that I gave on supplements, but really this doesn't have to be supplements. This is actually any therapy. I'm talking about integrative therapies, but it really could be any. So what are your goals for taking it? Is usually the first thing that I want to think about. It's very particular, I think, when you think about supplements in cancer care, because we have a lot of thorny issues here. Why do you want to do it? What's your goal? Is this for treating the disease? Is this for maximizing the benefits of other treatments that you're getting? Is it for symptom management as a result of the disease, or symptom management as a result of any of the other therapies that you might be getting? These are totally different questions, and you might choose different therapies as a result of how you answered this. For prevention, totally different, right? Prevention of new disease, prevention of worsening of the disease I already have, totally different. Maybe you have other priorities. Uncle Jim said this is the best thing since sliced bread, and everybody in our family says, I got to do this, I got to do this. It's a different priority. So there are a lot of reasons why you might want to take supplements or use some kind of other therapy. It's important to actually hone down on those specifics when you start thinking about, well, what's the right therapy and what's the one that's not right or wrong. Okay? Next, we'll spend a little bit of time here about safety and efficacy. Because when you talk about integrative medicine and CAM therapies in general, this is a big gray zone. Okay, you can use a diagram like this for any kind of therapy, and the way it works is like this. Right up on the top, does it work? That's the efficacy question. No, yes. Is it safe? Do we know anything about safety? No, yes. Right. So if it works and it's safe, well, yeah, absolutely. Why shouldn't you do this therapy? Really, a lot of times we're talking about, well, which one works best? So it's a competition about those that work. And ideally, all of the therapies that we have live right in this box. But as we know, that's not necessarily true. Right? It may be safe, but we may not know a whole lot about it. In which case, it might be worth a try if we are fairly confident that there's not going to be a problem as a result of this. Right? So this safety line is, no problem, we think. Down here, maybe some problems. But why would we ever then consider any of the therapies down here? Well, if it works, but it's not safe. Can anyone think of a therapy that might work? Marijuana? Marijuana, we don't, I'm not really sure where. Marijuana, I'd say, sits right here. Actually, most supplements sit right here. Chemotherapy, right? That's not all that safe, is it? But it's effective in some very specific cases, right? So, you'd use it, but with caution, and that's exactly how we administer chemotherapy, with regular visits and regular blood levels and follow-up and so on and so forth. And you could think about other therapies as well that way. And obviously, if we know it doesn't work and if it's not safe, forget about it. And there are some things that fall into this category. Now, when I'm coming, so you can think about this for any treatment, any medication, any other kind of therapy that you might undergo. When I think about it for supplements, marijuana being a great example, it works well for some things and for others maybe not. And it might be dangerous and it might not. We're right here. We don't know. And, these are the I don't know lines. These are the gray lines. When we start talking about supplements, this is the biggest I don't know area that I can think of in medicine from my perspective. It's very interesting for me. It's why I love to do research in this area, because there are tons of questions. It's a challenging place to advise patients on because we really don't know a lot. In a lot of cases, we don't know if it's safe or not because nobody's really looked. People have used it for a long time. Okay, that tells us something. It's not going to kill you if you take a dose today or tomorrow or the next day. But folks didn't take chemotherapy and radiation therapy 1,000 years ago. Right? That's 20, 30, 40, 50, 60 years of experience, and we haven't been looking very good about supplements and many of those treatments. for very long. There's a lot of I don't know there. So how do we deal with the I don't know? And this is probably the last concept about treatment that I want to mention here, is think about risk tolerance. There are patients that come into me all the time that say, you know, I told my doctor I'm taking these supplements, and they said, put them all away, and they come back, you know, and you shouldn't take any of them while you're taking your therapy, and I'm going to tell you I don't really care what they say. I'm going to do it anyway. And I might say, okay, well, let's talk about that. Have you thought that if you take this particular supplement and it interacts with this particular medication, that medication might not work so well? Right? Put a point on it. And some people will say, yes, I have, and I don't care, and I'm going to do it anyway. Okay? Right? So they're over here. Oop. Sorry. They're over here. Right? They're going to take whatever they want. And other folks might say, you know, I had never really thought of that. And I wouldn't want to do anything that might possibly alter the treatment that I'm currently getting. Right? They're over here. They don't want to interfere whatsoever. And if you think about this for any medication or treatment, you can usually identify yourself somewhere along that line. This is how I deal with the gray area. What's your personal preference? What do we know about what you're doing and what you're considering, and what might happen as a result? And are you willing to take, you know, so we'll try and quantify is not quite the word, but weigh out what the possible risks are, and then try and make a decision. Are you willing to, you know, does that seem like a reasonable risk to you or not? That's how I deal with that. So there's a framework for you. What are you taking it for? What do we know about safety and efficacy? What's the gray zone look like? And what's your risk tolerance? All right, last thing, disclosure. I maybe said something a little bit about this earlier, right? So I know a lot of patients hear from their doctors, don't do this, particularly with integrative medicine, and then they come to me and they say, well, I'm going to do it anyway. I know this. I know some doctors know that as well. We know this has been going on for quite some time because we've been asking the question of patients all the time. As we've watched integrative medicine use climb over the last 2 to 3 decades in the United States, you know, 10, 20, 30, 50%. It's probably about 35% in the general population, and you know, patients with chronic disease is probably 50 or 60% using them. We know that the rate at which people tell their medical providers about their CAM use is really low. And it hasn't changed over the last few decades. About 60 or 70% of folks will not tell their provider. In the cancer world, it's a few more. It's maybe 50-50, which is better, but that means half people aren't really talking about this. Why do I think it's so important? Well, when we ask folks, well, why don't you talk about this? Far and away, top 1 and 2. My doctor never asked. It wasn't important for my doctor to know. The first one, that's bad on me. Oops, sorry. Right? I should ask. The second one, though, it wasn't important for my doctor to know. This one surprised me when I first saw it. Why might it be important for my doctor to know? Well, as I said earlier, if I might be taking some supplements that might interact with my treatment, that might be important for my doctor to know. The problem here is that most doctors have no idea what to do with, you know, integrative medicine or CAM therapies because they don't know about it. By definition, this is the stuff that wasn't taught in medical school. So they know nothing about it unless they went out of their way to do it. So I understand why patients might not talk about it with their provider, but I want to impress on you how important it might be to talk about it with them, or at least mention it to them and perhaps ask, is there somebody here that I could talk to about this? And the reason I say this is it's really difficult to find good information on integrative medicine. I know where you all get your information from. It's, you know, it's mom and dad or brother and sister or the friend down the road. It's the web, it's Google. Google has the answer to everything, right? Yeah. They know everything. They know what's in my wallet now. What I think you should have and deserve to have is an informed opinion about these things. And if you don't ask if you don't demand of your providers to get that, you won't get it. And I know that you haven't been getting it. It's hard to get. It's hard to find services like ours where you can actually go and sit down with somebody for 45 minutes to talk about this and try and understand what do we know and what don't we know and how might that be beneficial, not just for supplements, but for the whole thing. At many of the large cancer centers now around the country, there are centers like ours where there is an integrative medicine person, so this is growing. And I think the more we press this with our providers, the more they may understand its importance and help to provide that service. This list, by the way, this is ordered, so most common at the top, all the way at the bottom, really uncommon. If you just look through, it's none of my doctor's business. They wouldn't understand. They disapprove or discourage me. They might even drop. Patients do say these things much less frequently. The thing that's up there, I think, that we have the most effect on is I should ask, and you should understand it's important to say. Okay? So with that, I think those are the things I wanted to present to you, and I understand there's probably quite a bit of questions. Yes? I don't know. Maybe you're going to be more out of this group than this. All right.
I promised a lot of questions.
Well, and I have this mobile microphone, so I can jump down and sort of, put you on the hot seat or get your, we can ask other questions. If you've got questions as I'm talking about these, raise your hand, spit it out. We've got another 20 minutes or so to talk. What do you think about ET? Does it really help according to studies? So you're going to have to tell me what ET is. I can guess, but what It's a capsule that you can take.
And you get it from the herbs.
And you get it from the herb. Terrific. What's in the capsule? This is a great question. What's in the capsule? You don't know, right? I don't mean to put you on the spot, but this is actually...
I'm not sure exactly.
Yeah.
But it's a Chinese limited.
Yeah. So, what's in the capsule? Let's just start with what's in the capsule, right? Thank you very much. This is perfect. I don't know what's in the capsule. And actually, I get this a lot. I'm taking this and that and the other thing, and have you ever heard of this? I haven't heard of every product that's out there. I've heard of a lot. I know the individual things. The Chinese formulas in particular are often mixtures of 10, 20, 30 different I'm not even going to call them herbals because they put all kinds of things in their mixtures. Very interesting, and they have a long history of doing this and even some success. So I don't know what this one is. And so to be able to answer your question about what do I think of it, I actually can't. But this is a common, I thought you might have actually meant Essiac tea, and I can say something about that. And then I saw tea and I thought, well, maybe green tea, because folks ask a lot about that too. And it may be a green tea capsule, but it probably is, like you said, a Chinese formulation with lots of other things in it. And I don't know. When you think about botanicals or dietary supplements, I can't stress enough how important it is to actually know what's in the capsule or what's in the jar, what's in the bottle. It's impossible for me to know. There are very few research studies on combination mixtures, and so that's really difficult. There are very few studies on individuals as well, but at least those ones I can sort of address. There's a question over here. So I don't know. The second part of your, so I don't know about ET. I don't know what's in it. ET. Does it really help according to studies? And so this is another important question and a point that I want to make. There are very few studies in humans with cancer, with metastatic breast cancer, pick any supplement that you want to talk about. So the amount of information that's out there on the supplements themselves to answer the question, will this help in somebody with metastatic disease, is pretty close to zero. Gray zone, right? Right on that line. Where's the efficacy line? That was the up and down line, right? Don't know. There's a lot of study out there. Okay, so according to studies, I'm sure there are plenty of studies on this, and what those studies are is somebody in a laboratory. I love working in a laboratory. I do clinical trials like I was introduced, but I also work in the laboratory. I think it's really cool. Somebody in the laboratory took a dish, had some cancer cells, sprinkled a little bit of their magic fairy dust on it, and they said, look at that. They stopped growing. Okay? They mixed it up into some mouse food, and they fed it to a mouse who had a tumor that was plastered to its back. And the mouse did better. So I look for these studies because I think they're wonderful. Those studies are not meant for you. And I say that in the best possible way. They're meant for me, the researcher. They're meant for me to open it and go, oh, that's really interesting. What don't we know about that, and how can we investigate it and figure out how to get that to see if it's helpful for people? That study tells you nothing about what happens in a person. And when we're talking about dietary supplements, doubly so. I know most dietary supplements, most herbals, when you eat them, they don't show up in the blood the way we would love for them to. Your body does a fantastic job of metabolizing them, of breaking them down and getting rid of them. So when you try and look for them in the blood, you see very low levels of them. I wish I could say otherwise. I think you heard earlier I was interested in curcumin and different formulations and how can you get into the blood. This is a completely interesting question to me, probably boring to other people, but I know that we don't see it. So the bottom line here is this study in a dish, this study in a mouse tells you very little about what's going to happen in a person, any person, a healthy person, much less a person who we're trying to treat a disease. Because it's not just the blood that it needs to get to, but it needs to get to that tumor or that other tissue, whatever it is that we're interested in getting it to. We have no idea. Okay? So I don't mean to be discouraging when I say we don't know much about it. There's a lot of that basic science stuff out there, but I'm very skeptical about applying it to a person because I know that it can really lead us in the wrong direction. Some of it can be useful. Some of it can be helpful interpreting safety data, for example. And you might start to think, is it worth a shot? When we're really thinking about risk tolerance, if there's something out there that says it could be beneficial, I might consider that, but that's not, I don't consider that typically great information for people. If we knew this stuff worked, your other providers would be giving it to you. And I really believe that. Whew. What are your top 3 recommendations for metastatic patients? And what complementary meds have the strongest positive data for cancer? So this one I have to meet head on. There are no supplementary meds with good data for fighting cancer. None. There are some that are interesting. I think curcumin is fabulously interesting, both for prevention and potentially for treatment. I'm still looking about how you get it in the blood into the tumor. In people, we're in people now. There are a couple of people looking at it in patients with pancreatic cancer and colorectal cancer in particular, but I can't tell you that everybody who has any kind of tumor ought to be on it. You might twist my arm and I might say, may not be a bad idea in particular cases. There are some good data, for example, for radiation-induced dermatitis. And I'm sure some folks here have experienced that, where curcumin may actually be helpful for that. There's a phase 2 study, which means we put it in a number of folks, like a fairly reasonable sized group of folks, about 50 or 60. And some of them got the curcumin and some of them got a placebo. And we looked at scores for radiation dermatitis, and it seemed like it did a little bit better. And now they're doing a much larger study, and hopefully in a year or 2 or a couple, we'll actually have an answer, and we could say, yep, everybody ought to get 2 grams 3 times a day who are receiving radiation treatment of any kind. This was particularly for breast cancer, but it actually doesn't necessarily, it might not be limited to breast cancer. So I can't tell, there are, oh boy, I should probably speed it up because now you met my challenge. So top 3 recommendations. Don't look to integrative medicine, particularly supplements for treatment of cancer, primary treatment of cancer. That's probably my #1 recommendation. And I sort of am a little heavy-hearted to say I wish I could bring something to you that said do this, but I don't. For symptom control, for symptomatic control, depending on the symptoms, there are probably a number of them that I think are useful, and particularly where we don't have good medicines, like fatigue, for example, and American ginseng. Something that I end up talking to most patients about is probably acupuncture. It's probably the most underutilized integrative medicine therapy. I love it for a variety of reasons, largely because I don't have to worry about this interaction issue. So whether you're during treatment or after treatment, but you might still be on some medications, or you might have other chronic diseases for which you're on medications, and I'm concerned about the supplement piece, you don't have to worry about that for the most part with acupuncture. It's mostly safe if it's done by a qualified person, and they're, in the United States you can find them everywhere. We have one that works specifically with us in our cancer center, so he's really on the ball in terms of treatment and how to do this well for people. We're just opening this up for head and neck cancer patients as well who are receiving radiation. They can't swallow and so forth. It works really well for a variety of things, and I don't have to worry about the interaction. And so I frequently end up talking about it. Not everybody wants to go see somebody that's going to poke more needles in you, and I get that. That's fine. But think about it. Exercise. What's a dose of exercise? I think about doses. I like to think about doses a lot. I'm that kind of a person. What's a dose of exercise? 20 or 30 minutes every day. How intense should it be? Enough to get your armpits sweaty. Not if you're standing up on a stage like this, like here under all the lights where I'm kind of sweaty, but you actually need to move until you're a little bit sweaty. And there's good evidence that it helps you, with sleep and fatigue and quality of life, and even for cancer recurrence, there's reasonable information around that. So those are probably my top 3 recommendations. Is acupuncture contraindicated for patients with lymphedema? Absolutely not. You could certainly do acupuncture. You might not put a needle in the place where there's lymphedema, but the rest of the body is fair game. So absolutely could be done. And we do it. Lymphedema therapy, obviously, is a terrific primary therapy for the lymphedema. Acupuncture can be helpful, especially when there are other symptoms that we want to address. Some oncologists discourage patients from getting massages while under chemotherapy treatment. That's true. What are your thoughts about this? We provide free acupuncture in the hospital. You get 2 free sessions here, and then you can pay for that. We have a massage therapist that we hired who trained up in the massage program at Memorial Sloan Kettering in New York. So those people and us, we sort of think the same. We actually have another person in the infusion center. Maybe that'll answer the question. Put a point on it. We have somebody who does hand and foot massage in the infusion center for anybody that wants it. I think this is absolutely fine. The contraindication for acupuncture for massage and cancer is don't massage directly over the tumor site. And obviously, if you've had surgery, you have to be careful about a surgical site as well. Otherwise, absolutely fine. What types have demonstrated effectiveness in clinical research? I presume this means what types of CAM therapies have demonstrated effectiveness in clinical research. So I have to go back to the for what question. I'm doing a comparative effectiveness review for ARC in depression. And we're looking at depression medications and CAM therapies, and there are actually a few. In cancer, I can't say there's good effectiveness data for any of the therapies. There's reasonable efficacy data, and that means we did it in a very controlled environment, and it worked in that controlled environment. When you talk about effectiveness, it's what happens when you just kind of give it out to the way people typically use it, and we don't have good effectiveness trials in cancer yet. Are all CAM therapies geared towards symptoms, or do some address the cancer itself? There are some people who are looking at CAM therapies for the cancer itself. We've had a number of failures. SCACT, I mentioned earlier, people thought was great. No. Vitamin C, that's high dose? No, at least not the oral kind. There are a couple of trials of high-dose IV vitamin C out in the Midwest, and for anybody that's interested in something like that, I'd say you want to do that under a controlled clinical trial. that's interesting, but I can't say that we don't know the answer yet. And there are others as well, but there are none that, oh, there are more? There are more. None with good data yet that say, here's what you should do. Mistletoe is another one. There are a number of studies on mistletoe. They're not very well done, so it's hard to trust the findings of those studies, unfortunately. How do we get insurance to pay for it? God, if I knew the answer to that. Does anybody know? You know, I need to have dinner with the head of Blue Cross Blue Shield here one night and somehow figure it out. You know, we're in a Republican environment, so it's how do you prove return on investment, right? That's how this works. I don't know. I don't know yet. My opinion is if I can show that it works, somebody ought to pay for it. That's what we have in our system. That's the argument to CMS, Center for Medicare and Medicaid Services. And that's what I hope to be able to show for a number of these. And then insurance companies will follow. I think where you can show there's a benefit to longevity, where you can, one of my takes is, well, where can we get people to complete treatment? Because we know people who complete treatment tend to do better. You know, maybe there's a gain there as well. You have to show, you know, where there's a return on the dollars for this. And I haven't figured that one out yet, but I'm thinking about it a lot these days. Because I know none of this stuff is covered, and y'all have to pay out of your pocket, and it's not cheap. We used to have acupuncture covered in this state, and most insurers stopped about 5-6 years ago. Lysine works. Oh, the other thing I'd say about that is we do have these, you know, plans. You can put away dollars from your paycheck every month, and you could use, you know, and they're tax-free or pre-tax, something like that, and you can use them to pay for many of these services, which is what I recommend folks do these days. Lysine works to prevent mouth sores. Is it safe? Are there risks? It tends to be safe. It does work really well for herpes mouth sores. Not so sure about mouth sores as a result of dry mouth due to radiation, or chemotherapy, if you're talking about. But for that, I would recommend acupuncture, which does work.
What was that?
The question was L-lysine, which is a supplement. Does it work to prevent mouth sores? Is it safe, and what are the risks? It's safe. It works to prevent mouth sores related to herpes. So if you get cold sores from herpes. But if you have dry mouth because of your chemotherapy or radiation, I don't think it works quite so well for that. But acupuncture does work well for that, for the dry mouth.
So as a preventative, or when you have a flare?
During the time. We think it's during the time, we're looking at it during the time of radiation treatment. So if we give it during radiation treatment, people do better. They have less dry mouth and less mouth sores as a result.
Does it work for chemo-induced cancer sores?
Don't know. We haven't looked, and I'm not sure that anybody else has. I think it would be reasonable to try. You know, that's probably in the B category. We don't know if it works, but it's probably safe. In which case, yeah, that's reasonable to try, so long as you can afford it. And that's usually the challenge. Oh, frankincense. I thought that said Frankenstein. Sorry. You know, I need a new prescription. Frankincense has been used in metastatic breast cancer in Europe. What's your feeling about the evidence and efficacy for use in the U.S.? I don't know. I love the way it smells. And I don't mean that to make light of it. I actually don't know. I wasn't aware of, this is a new one, and I will look into this. I'm not sure how it's being used. And so I'm going to actually keep this one over here because I learned something new from my patients and you guys all the time.
You can actually go to Ecuador and have it inject the
Frankincense, extract of frankincense. Interesting.
It's been shown to work.
And it's been shown to work. Well, let's have a look at that. That'll be new for me. And I hear new stuff, and I'm always willing to look and hear and listen. Unfortunately, what I often find, and this was the case with the mistletoe, Iscador, if you look at the trials at how they were done, they're not done well, and a trial that's not done well and reported well can just as easily mislead you into thinking that something works when it doesn't. That's from my researcher's perspective. I've seen it a number of times, many times. So I am skeptical I like to look, but I'm skeptical. What are your thoughts on mistletoe therapy, B17, Protocell for cancer treatment? Have you used any of these or researched them? I have not researched them. I have not used them. I had one patient who really was going to use mistletoe no matter what. There is a provider in our area who has provided the injections in the past, and so I referred that patient to this provider. I don't feel comfortable, I'm not an oncologist, so I don't feel comfortable providing primary therapy for cancer. I deal with symptoms, I deal with the rest of the person and the body. I may make recommendations. I'll often educate patients on what they thought they heard from their cancer providers and they didn't understand, and so that happens, but I don't provide primary therapy. For folks who've asked for high-dose vitamin C, I'm very happy to speak to the folks in Kansas and the folks in the other places in the country who are doing these trial protocols. And if I can get you on the rolls there so that you can receive their treatment, I'm very happy to facilitate that. And I'd say that about all three of these. I don't know much about using apricot seed and Protocell. I don't actually know what Protocell is. Oh, Laetrile. Okay, Laetrile. Yeah, no. Yeah, the data on Laetrile, I actually think, right, so, which is similar to apricot seed, but not quite the same. Right. No, I don't recommend that. Does turmeric or curcumin interfere with Cytoxan-induced apoptosis? Love it. And if so, why, since turmeric induces apoptosis? So I can't answer your question now, but I get this I have to think about this kind of question every day in my clinic. And there's too many combinations for me to keep up here. My brain gets smaller and smaller and smaller the older I get, I think, or the more children I have, I think is how that works. I have 4, by the way. This is an easy question to answer once I open up a book and go, okay, what's the mechanism of, for Cytoxan? And I know a bunch about curcumin, so I'd actually just have to take a couple of minutes to look at Cytoxan. And my email address was up on there, and if you wanted to email me this question because you're really interested in it, I'd be happy to take a few minutes and actually respond to you, okay? It probably has nothing to do with the apoptosis mechanism. It probably has a lot to do with the metabolism of the two agents. I'll keep this one over here, too. For survivors and caregivers, supplements for inflammation, prevention, foods, where do you start? Yeah, right. So this is a lot of questions, and we have just a few minutes. And we could talk a whole hour just on this. Inflammation comes up a lot, usually in the context either of supplements or diet. And that tends to be where I steer people to, is the diet. What's inflammatory, what's anti-inflammatory, how important is it for cancer treatment and prevention? It's really an interesting literature. It'll keep a dork like me up at night reading, thinking about it. Most people it'll put to sleep. Don't know. We have a sense that inflammatory processes are involved in many chronic diseases, including cancer. It seems like a reasonable hypothesis, is the way my scientist brain would put this, that if we reduced inflammation, people would do better. They might do better in treatment. They might not get the disease in the first place, maybe. Those all seem like reasonable, really interesting hypotheses. The answer is we don't know. There is some data that says folks that eat an anti-inflammatory type diet tend to have chronic disease less, and when they do have chronic disease, they don't suffer from it as much. So if you really wanted to go out on an extreme, what's an anti-inflammatory type diet? A vegan diet, no animal products, right? And that's just, there's a science behind that that's fairly simple. That works, that will get you there. Is it going to prolong your life with whatever condition we're talking about? I don't know. Nobody knows. So when I have this conversation, we talk about the diet. I will often steer away from supplements and more towards diet. The same thing about antioxidants. I know there's a question about antioxidants in here. I don't know where it is, but I can feel it. There always is. Right? Should I take an antioxidant supplement? Same thing. Radiation, chemotherapy induces oxidation. It's how it kills the cells. The body needs oxidative processes because that's how it works. That's the biochemistry of it. What's the balance in there? I don't know. Nobody knows. You know, can you take an antioxidant? Is it safe? Does it do anything that's important? Nobody knows, right? So if you're under treatment, we might want to steer clear of the high dose antioxidants, which are supplements, right? But you get antioxidants every day in the foods that you eat. So if I were to steer towards a safer middle path, get it in your diet. Right? When we talk about anti-inflammation, you can take all kinds of supplements till you turn blue or green in the face. Get it in your diet. With the exception of you might want to take an omega-3 fatty acid supplement. That's anti-inflammatory. 2 to 3 grams a day is a typical recommendation for something like that. Otherwise, get it in your diet. And you really can get the omega-3s in your diet too if you really focus on that. Where do you start? Come see me or somebody like me. Go see your dietitian, because cancer centers typically have dietitians these days and can talk to you some about this. And if they can't, then demand it. And if they don't have an integrative medicine person, demand that too. You know, there is a whole bunch of supplements for inflammation or supposedly inflammation. Curcumin is one of them. There's a popular commercial product called Zyflamin that has a half a dozen of them in there. Does it help? You know, you can see I'm a little half-hearted about it because I don't know yet. I think it's interesting, but I don't know yet. What's that?
How do you take curcumin?
It's a capsule. They usually come 500 milligrams at a time, and folks will often take, when we do trials, it's often 4 grams a day.
With blood pepper?
Not necessarily. Yeah, I mean, that's
4 grams versus 500?
the capsule is 500 milligrams. So this is actually tough because it means taking 8 capsules at a time, or dividing it into twice a day. I don't necessarily recommend taking it with black pepper because I'm not sure that it gets you to absorb it a little bit more, but it gets metabolized just as quickly, so I'm not sure that it actually matters yet. Yeah, black pepper has piperine in it, which helps. It blocks one of the pumps that pumps the stuff back out so that you can absorb it a little bit better. And there are other ways of trying to absorb better as well, but still in the end what we measure in the blood is like, you can barely see it. There was a question over here? No? Okay. When on a trial, do you think supplements need to be weighted or stratified into the results? Right, so I think this question is, actually we know a lot of people who are on clinical trials, they're often told not to take supplements, and they often do. And might that have an effect on the outcome? And of course, if you don't know, right, if you don't know about it as a researcher, that could really confound your results, and that's an important factor. Now, if people are randomized, as a randomized trial, presumably the randomization will even out both sides, but it's hard to know. So yeah, I think it's certainly a condition. It's certainly something to consider. Do you have an opinion about vegan, vegetarian diet? So I just gave it to you. I've been a vegetarian for 25 years. I love food. Can you comment on what you know about curcumin and metastatic breast cancer, or curcumin and cancer treatment in general? I know very little about curcumin and breast cancer because I study colorectal cancer. I have an interest in breast cancer, and what I could tell you about curcumin and breast cancer, I just told you about radiation-induced dermatitis. That's what we know about curcumin and cancer. There's some really interesting information that says curcumin may help to reverse chemoresistance and radioresistance, which means you'd get a chemotherapy agent, you get radiation, it kills some cells, but some survive, and they become resistant to that treatment, you know, and then you need a different treatment, and there is some, you know, sprinkle it in a petri dish kind of information that says you might be able to overcome some of that resistance with curcumin. I don't know if that's really true. I'm very interested in looking at that question, and maybe when you come back in 5 or 6 years, I'll have an answer for you. What do you oh, I think we got to them. Okay, that's the ET question. Oh, I think I put new ones underneath. What's your opinion about dietary recommendations by Dr. Colin Campbell in the China study? I'm afraid I don't know this study. Yeah, I've got my head in a hole. You know, let me back up just mea culpa, right? CAM is huge. I can't keep up on all of it. And so that's why I say I learn stuff from you. There are a lot of big studies. I don't know the China study. Can somebody in one sentence tell me what the China study?
Quite old, about 20 years old, there was a study in China, and very many recommendations on the usual fat intake for breast cancer.
Oh. So this was a study of dietary intake. Was this one of the ones where they looked at soy as well?
Well, he's a professor emeritus at Cornell, and he was the nutrition advisor under President Ronald Reagan.
Under Reagan.
Was asked by the country of China during the 70s, before it was before they we moved around a lot, to analyze dietary and health outcomes in different villages. And the conclusions he drew then were that the villages that practiced a vegan diet had little to no diseases of affluence.
Yeah, okay. So under Reagan, so is this the guy that said green jello was a vegetable too? No, I'm just kidding. Oh, ketchup was a vegetable. Maybe that's the hyperbole. I'm just joking. That makes a lot of sense. Whether or not that was and I am familiar with that. I just maybe wouldn't have called. I guess it's called that. There are a number of reasons why folks in a small village, not just diet, might not fall prey to a number of chronic diseases. Diet may be one of them. I actually haven't looked and read over it, so I couldn't really comment on it. Any comments on curcumin? I've given you some of those. But thank you for asking. I always love to talk about curcumin and curry. Melatonin. I do recommend melatonin now and again, but I recommend it for sleep, and it's really people who have a difficult time falling asleep, and it's not chronically difficult time falling asleep. It's every now and again. Terrific if you get on a plane like you came from the West Coast and you're now on a new time zone and you need to fall asleep and kind of get into a new cycle for a few days. I find that when patients take it every day, it doesn't seem to help them fall asleep quite as well later on. And if they stop taking it and start it again, it seems to work a little bit better. There's a lot out there that you should take higher doses because it might have an effect on tumors, and I'm just not there yet because I don't think the data are convincing to me yet. It's probably not harmful, so I think for folks that want to take it, that's probably okay. I'd probably put it in that B box up there. Probably not harmful, not really sure it would help. I do recommend it in lower doses for folks who need a few nights sleep. Anywhere between 3 and 5. 3 to 5. Oh, what helps for sleep instead of, you mean in addition or instead of this? Right, exercise. Acupuncture can be helpful. There are some supplements, if we don't have to worry about interactions like chamomile and valerian and passiflora, that can be helpful too for a night's sleep. I don't know about for a long-standing chronic problem though. We're at 4:02. There are a couple more here. Can I finish them up? Nobody's going to kick us out? I'm going to keep going until somebody pulls a cane out and pulls me off. Are drugs that are used off-label for breast cancer, such as rapamycin, considered complementary treatments? No, they're not. In the sense that I'm using, it's a good question. That's why I threw up that definition up there. No, they're just off-label uses of conventional therapy, but they wouldn't be considered complementary therapy. Last question? All right, I got it. As far as diet, what do you suggest metastatic patients avoid? For example, soda. Yeah, sweet drinks, highly sweetened things, highly processed foods. That's a general recommendation I make to everybody, so not just to this group, but to any group, whether it's a cancer group or even a non-cancer group. And I think I'll stop with there. I can hang around for a few more minutes over here if folks want to ask questions, and thank you very much.